Bladder cancer is a critical health concern that arises in the cells of the bladder, the organ responsible for storing urine before it is expelled from the body. The most prevalent type of bladder cancer is urothelial carcinoma, which begins in the urothelial cells lining the interior of the bladder. One notable aspect of bladder cancer is that it is often detected at an early stage. This characteristic makes it one of the more treatable forms of cancer when diagnosed promptly. The primary risk factor for bladder cancer is smoking. Tobacco smoke contains numerous harmful chemicals that, when filtered through the kidneys, are excreted in urine. These substances can irritate and damage the bladder lining, leading to cancerous changes over time. Research indicates that smokers are several times more likely to develop bladder cancer than non-smokers. However, smoking is not the only risk factor. Exposure to certain industrial chemicals, such as aromatic amines commonly found in dyes, rubber, and textiles, can also increase the risk. Additionally, chronic bladder inflammation, often resulting from recurrent urinary tract infections or other irritants, may play a role in the development of cancer. Family history is another significant risk factor for bladder cancer. Individuals with a family history of the disease may have a genetic predisposition that increases their risk. Age is also a critical factor. Most cases of bladder cancer occur in individuals over the age of 55, with the risk increasing as one ages. Other factors that may contribute include a diet high in processed meats, certain medications, and even exposure to radiation or chemotherapy for previous cancers. Symptoms of bladder cancer can vary, with the most common being blood in the urine, known as hematuria. This symptom may be visible, appearing as a reddish or brownish tint to the urine, or it may be detectable only through laboratory tests. Hematuria should never be ignored, as it can also indicate other medical conditions. In addition to blood in the urine, individuals may experience frequent urination, painful urination, or a burning sensation during urination. Pelvic pain and discomfort may also occur, especially as the cancer progresses. In advanced stages, bladder cancer can lead to more severe symptoms such as swelling in the lower legs, bone pain, unexplained weight loss, and fatigue, signaling that the cancer may have spread beyond the bladder. Diagnosis of bladder cancer typically begins with a thorough medical history and physical examination. If bladder cancer is suspected, a cystoscopy is usually performed. This procedure involves inserting a thin tube equipped with a camera into the bladder through the urethra, allowing doctors to directly visualize the interior of the bladder and identify any tumors or abnormalities. If suspicious areas are found, a biopsy may be performed to obtain tissue samples for laboratory analysis, confirming the presence of cancerous cells. In addition to cystoscopy, urine cytology tests may be conducted to examine urine samples for cancer cells. Imaging scans such as computed tomography, CT, or magnetic resonance imaging, MRI, are also valuable diagnostic tools, helping to assess the extent of the disease and determine whether it has spread to nearby lymph nodes or other organs. Treatment options for bladder cancer vary significantly based on the stage of the disease. In early-stage bladder cancer, transurethral resection (TURBT) can be performed. This minimally invasive procedure involves the removal of tumors through the urethra without the need for major surgery. TURBT not only helps in diagnosing the cancer, but can also serve as a treatment to eliminate superficial tumors. For more advanced bladder cancer, treatment options may include a combination of surgery, chemotherapy, radiation therapy, and immunotherapy. In cases where the cancer has invaded deeper layers of the bladder wall or has spread to nearby tissues, a partial or complete cystectomy may be necessary. This surgical procedure involves the removal of part or all of the bladder, which may significantly impact urinary function. Patients may require reconstructive surgery to create a new way for urine to exit the body, such as a neobladder or urostomy. Chemotherapy is often used in conjunction with surgery, particularly for muscle-invasive bladder cancer. This treatment involves the use of potent drugs to kill cancer cells or slow their growth. Chemotherapy may be administered before surgery to shrink tumors or after surgery to eliminate any remaining cancer cells. Radiation therapy may also be recommended, either as a primary treatment or to target cancer cells that remain after surgery. Immunotherapy has emerged as an important treatment option for bladder cancer, particularly for patients with advanced disease. This approach harnesses the body's immune system to recognize and attack cancer cells. Drugs such as checkpoint inhibitors have shown promise in treating bladder cancer, providing new hope for patients with limited treatment options. The prognosis for bladder cancer largely depends on the stage at which it is diagnosed and the effectiveness of the treatment. Early detection greatly improves the chances of successful treatment and recovery. The 5-year survival rate for bladder cancer diagnosed at an early stage can be quite high, while the rates decrease significantly for more advanced stages. Regular checkups and monitoring are crucial for individuals at higher risk, including smokers and those with a family history of bladder cancer. Preventive measures and lifestyle changes can play a pivotal role in reducing the risk of bladder cancer. Quitting smoking is one of the most significant steps an individual can take to lower their risk. Additionally, minimizing exposure to industrial chemicals and maintaining a healthy lifestyle, including a balanced diet rich in fruits and vegetables, can help support overall health and reduce cancer risk. Staying hydrated and practicing good urinary health can also be beneficial. In conclusion, bladder cancer is a serious condition that begins in the cells of the bladder. Understanding its causes, risk factors, symptoms, and treatment options is essential for awareness and early intervention. With advancements in diagnostic techniques and treatment options, there is hope for improved outcomes for individuals diagnosed with bladder cancer. Regular screenings and awareness of symptoms can lead to early detection, significantly enhancing the chances of successful treatment and recovery. Information. All information in this article has been compiled from open sources and shared for informational purposes. It does not constitute a recommendation or treatment. For more detailed information, examination, and testing, please consult your doctor